Hello, everyone, and welcome back to the Right Brain Podcast. It just took us a little while to get set up in here because I keep switching sides. If you haven't been noticing from watching this show, I can't decide which side I want to be on because every time I think I look insane. And then my dad was telling me that if I sit on the side he's sitting on, then it's going to activate my left brain and it's going to make me feel better. But
well, you actually said
chose
that.
beauty over brains today.
Well, that's it. It's better, like Billy Crystal used to go, it's better to feel good than to be, it's better to look good than to feel good, right?
I couldn't agree more, Billy Crystal.
Yeah, and he's from Long Island, so. Anyway, so you were trying to choose where you feel you look better.
Yeah.
But you said that you felt better on this side. So you look at that, and of course, I'm going to explain that from a neuroscience perspective. So sitting on this side, looking at me.
Which side are you? He's on the left side, and I'm sitting on the right side.
Right. So to look at me, you would have to look towards what's called your right visual field, right? So you would look to the right, which is going to bring vision primarily to your left brain more. And so since you have a left brain deficit and your right brain is too strong, and your right brain being too strong is what causes you to feel more anxiety and all of the things that we've talked about, that as you activate your left brain, it actually brings it up, and that makes you feel a little bit happier and more confident. And so you would actually probably feel better in this seat, which is what you said. And that's something that we can use as an analogy. Like, when we're looking at, let's say, working with kids that have learning disabilities or that, have a deficit, like, a learning disability where they may have a left brain deficit. I tell the teachers that child should sit on the right side of the room or on the left side of the room so that they can look at the teacher more through their right visual field. And then when the teacher comes over to them, they should approach them from the right side, speak in their right ear, let the child look a little bit more to the right, and that accesses their left brain and actually makes them feel better and will help them to learn better that way. So again, just by something like vision, or same thing with hearing or auditory, we can manipulate our world around us and whereas most people feed into their strengths, right? Most people are going to go, well, I'm good at this, so I'm going to do that. But that's a trap because it actually ends up making you feel worse because it actually feeds into your strength and makes the imbalance worse.
Yeah, but who cares if I look ugly doing it?
First of all, you can never look ugly. You look beautiful either way.
No, but that's something that I feel like people after listening to this will think about when they're on dates. Like if you guys are sitting at a bar together, you're going to be like, excuse me, I need to switch on this side so that you can talk to my left brain more so I could be more charming.
And that's why it would be perfect for a person who's right brain to be with a person who's left brain, because if they sit on opposite sides of one another, they can access the weaker side of their brain and both make each other feel better.
Yeah, but not if one has avoidant attachment and an anxious attachment. Didn't we learn anything from a couple episodes ago?
That's true. That's true.
Okay. Also today we were just at brunch and we were talking about how we might talk about food sensitivities today. Because that's something, even though you said, because I don't know, a lot of people say that the gut is your second brain, but you said that's not true, but it has a lot to do with.
Yeah, it's definitely important, but yeah, it's not the second brain. I mean, it's not even close. Your brain is.
I'm just repeating what I heard.
Yeah, I know. And that's why want to let people know, because in the world out there we have traditional medical type of approach. And traditional medicine is really pretty basic. As we've learned, it's probably best with infectious disease, even though obviously we've seen that whole calamity. And it's really more for, again, saving someone's life, like emergency medicine. Traditional medicine is good. Otherwise, it's all about just managing symptoms. And traditional medicine, I mean, we could go back into the roots of it, but basically, it started in the early 1900s for the most part when, people didn't have what we call chronic illnesses. They had an accident on the farm, or they got an infectious disease, or, they had some other type of issue. And that's what most people died of, if not just old age.
Okay.
But over the last, 50 years, people don't die hardly ever from infectious diseases or from, acute issues. Now they die from what's called chronic illnesses. And so, when you look at dealing with only managing symptoms, you're not really dealing with the core issue and chronic. And that's where two different types of modes of treatment, one that I had something to do in developing, functional medicine and functional neurology, were more about, well, let's actually look at the function of people and what their optimum level should be. But the people in the functional medicine world don't really know anything about the brain and the nervous system. And the gut does play a huge role. And they're basically trained and think and say that, well, it really all starts in the gut, because in their model it does. And then it affects the brain in some kind of mysterious way that they don't know. But when you really understand the brain and the nervous system, you realize that, no, what's happening in the gut is actually happening because of an issue in the brain, and then it affects the gut, and then the gut can affect the rest of the body. So it doesn't start in the gut, and that's not really where food sensitivities start in most cases either.
Okay, so what are the typical issues that someone with a left brain deficit would have, and what are the typical ones that someone with a right brain deficit would have?
In regard to general illness or food sensitivities?
Yeah, food sensitivities and like digestive issues and all of that.
Yeah.
I cannot pronounce words today, sorry.
Let's not go into that. But instead of talking about schizophobia.
My dad, obviously, this is not an episode about dyslexia, so we'll save that for another time. But yes, I'm dyslexic, just like obviously it seems like I have every mental illness that we talk about. But I just sent him notes on like the things that we like talk about when we like plan out these episodes. And I wrote what I thought was schizophrenia and psychosis, but what did it actually say, apparently?
It said schizophobia and physicosis, which I think are two of the funniest words. Like I said, I don't think you could have made a funnier word than schizophobia. It's just hysterical. It's so funny. We're going to do an episode on schizophobia, but we have to figure out what that is.
Probably something, just keep studying me. I seem a little schizophobish for
Maybe
sure.
Because you're wearing fur? Is that
that could be it. Yeah.
It's not real fur. Don't let Peter come and attack us.
Okay, anyway. Yeah, so I'm having a tough time spelling and pronouncing words today, but we're going to carry on.
Which is part of your right brain gift, which is amazing. So what were we talking about?
I said, what are like the food sensitivities and issues that of each side of the brain that are typical?
Yeah.
Yeah.
So interesting thing is that when we look at that, through my research, what we've been able to show is that almost most things that are in that chronic illness realm, but especially if it involves mental health in any way or neurological issues, really start in childhood. They're developmental, right? Like, we go back to your early childhood and, there were some things from the beginning, your talent was there, but also some of your issues were there. Mm-hmm. Schizophobia was there.
It wasn't there yet.
No, it came later. So what we see is that overall, when we're talking about, anything that's impacting a lot of your metabolism or your digestive system or your immune system, it involves what we call the autonomic autonomic nervous system. And there are two parts of that, what's called the sympathetic nervous system, which is typically referred to as the fight or flight. And then there's the parasympathetic, which is more the rest and digest and repair part. And really, you can also look at it like sympathetic is more what kicks in when you're in danger or you feel like you're in danger. And the parasympathetic is when it kicks in when you're calm, when you're in safety. So your body and your nervous system know, if I'm in danger, my heart rate needs to go up. I need blood flow to come from my gut and go to my muscles and to my brain so I can run away. And everything becomes brighter and louder. And, your digestive system shuts down, and that should be a short-term thing, right? You're either going to fight or you're going to run away. And then, your body should calm down. When you're in safety now, your parasympathetic kicks in, and that brings blood into your gut and to your organs, and it calms things down and slows your heart rate, and that allows you to be more social, that allows you to relax and eventually sleep and rest. So when we're born, that fight or flight is on from the very beginning. So before we're born, babies are in like this fight or flight state. And when they're first born, that part is there. And the parasympathetic really isn't there yet. And so babies, they look like they're stressed out. They scream, they cry, they don't sleep much, they can't eat solid food. They're in this kind of fight or flight. Then as their brainstem develops, and as especially their right brain develops in the first 3 years, the parasympathetic nervous system kicks in and inhibits and shuts off that fight or flight. And so babies will eventually be able to eat solid food, they sleep through the night, and they feel, they feel more, they're able to self-soothe, they're able to regulate themselves and be calm and feel safe. And that all happens, in a certain developmental trajectory. Now, if there's a problem with either the left or the right brain, where there's a delay, we tend to stay more in a sympathetically dominant state. So that we see that people that have left brain issues and right brain strong, like, songwriters and artists, as we talk about, they can have, digestive issues where you have problems digesting food and breaking down food, and pain and discomfort and bloating, and, maybe more constipation. And also that may develop food sensitivities, but people with right brain deficits and left brain strong tend to have more severe. So that's why if you look at like the idea of gluten and dairy, gluten and casein as the primary food sensitivities that everybody knows about now, that really started in the autism community like 30 years ago, where parents were noticing that if they took kids off of gluten or dairy, that many times their symptoms got better. And that's what started a lot of the issues about looking at the gut and the immune system. And that became such a prominent issue that eventually it became mainstream. Now everybody looks at that, right?
Yeah.
And everybody's struggling with issues. And even though it's so much more complicated than that, and we'll talk about that, that idea really started in, the autism and child development community.
Interesting. Okay. So, and that, yeah, because a lot of the kids that come to you, we've talked about this before, but he works with a lot of kids with autism. And one of the first things you do is put them on like a certain diet, right?
Well, that's a good question. I mean, we definitely look at their diet, but, as a matter of fact, recently, I was just contacted by a researcher from the NSA, the National Science Association, which is really one of the huge research areas. And she was saying that they asked her to do an extensive research on diets for kids with autism and work with families. So she went out and she spoke with, some of the top people in the world in functional medicine and diet and nutrition. And she said, they had a lot of great ideas about things that they can do. The problem was they all would say the same thing. These kids are such picky eaters. I mean, they're insane from a standpoint of they're so particular. They'll only eat like 1 or 2 foods. And so how are you going to change the diet in something like that? Because they just literally won't eat. And so they can come up with all these diets. And then, of course, because they're children, they can't really swallow pills. And so they have all these things, but they can't use them in the majority of kids that with autism or ADHD or many young issues because they're so picky. And so she said she got my book. One of my books is called Disconnected Kids Nutrition Plan. And in it, I talk about how we look at diet and nutrition, but from the brain and nervous system's perspective. And that is unique. No one's ever written a book looking at it from that perspective before. And in that, I say, first thing we need to do is change the brain, because then we change their eating behavior. Now, all of a sudden, they're eating because of taste and smell, which they normally don't have that. and they're not as obsessive, and they're actually starting to feel hungry, and they will now change their eating behavior and now become open to more foods. And now we can start to look at their diet and look at what they may be, what foods they're reacting to. And now we can start to work with that. But we don't do it first off because, we're trying to grow their brain, literally physically grow their brain. And the brain requires 20% of all calories and oxygen in your body. So it's huge. It's a huge amount. And if we're trying to grow the brain, especially at an accelerated rate, meaning it's growing faster than it normally would, it takes a lot of energy. And if these kids shut down and literally don't eat, that's counterproductive. So that's where, from my perspective, we don't just start with diet and eliminating right off the bat. And that is a relief to a lot of parents because they know they've tried it, and their child will just literally shut down and not eat. And it's a battle and a fight. And most mothers, especially, and dads, but especially mothers, there's this ingrained thing in them that their child, mothers literally feed their babies from their body. And if your child doesn't eat, it causes you so much stress and pain. And that's where a lot of moms will be like, well, I'll let them eat anything. And they may eat a lot of crap. But, so it is an important tool. But again, when you only have that as a tool, when you only have diet and nutrition, you start there.
Yeah.
And I said this to this woman, this researcher, and she said, you know what? They all said the same thing, that they couldn't implement the diet. You're the only one that has talked about why they won't eat and how we can change that. And she said that's like really, really important. So, it is that's the different perspective when you're looking at it from our brain.
Okay. Wow. Okay, that's very interesting.
Yeah.
And you said that because we were talking about panic attacks earlier. I know you said that like when your gut doesn't feel well, like because like your body's trying to convince you that you're sick, so that it makes you feel depressed or those types of things. Like can having gut issues cause panic attacks, or that's different?
Well, they may be related in some ways because it's all part of the same system. But, if you're in this fight or flight type of state all the time, and if you feel like, if your stomach's bloated and you're feeling pain, and then as you said, this is also that fight or flight and rest and digest system really also regulate inflammation and anti-inflammation. And so if your body's inflamed, if you're feeling bloated, if you, or that can also, the inflammatory chemicals can make you more depressed or make you more in an anxious state. But, panic attacks and that type of anxiety and what is often maybe associated with agoraphobia, like people not wanting to go out, not wanting to leave their house. They're often interrelated, but it's built on the same system, obviously the brain and the autonomic system, but it's more of a particular thing that's going on. And sometimes there are also physical mechanical issues that come around that affect your breathing. Oh yeah. Like you've talked to me about how your ribs get so locked up and you feel like you can't breathe, and it makes you feel like you're gonna.
Yes, I get bad panic attacks. I actually haven't had one. I think I had a really bad one maybe like a month and a half ago, but it was the first time in a long time. I used to think it was just the full moon, but I think there's more to it, obviously.
So when you feel a panic attack coming on, what happens? What goes on with you? What starts first? What's the first thing you notice?
Chills just thinking about it. My face will get like pretty numb, and then I'll like feel like I can't breathe, and then I'm just like spiraling. Like I feel like I'm like, I don't know, stuck in like a static TV or something. Like I'm just like, everything is doomsday, and I'm just like, I can't breathe, and I'm like, oh my God, I think I need to go to the hospital.
Right. And you feel like you're going to die.
Yeah.
Yeah. So with that, if you think about what you just said, and this is true in most of the cases, it does not start with anxiety, right? It doesn't start with being anxious over something. It actually
feels like it does.
But it starts with a physical symptom. Like you said, I can't breathe.
Yeah.
So you can't breathe, and then that triggers anxiety.
My hands will get numb too. My
Right.
face and my hands.
Exactly. And that's how you know that it's actually primarily a breathing problem. And you're hyperventilating. So I've worked with a lot of this throughout my career with people, because it's often associated a lot with, other things like back pain, neck pain, or chest pain, or...
Yeah, that's what happens to me. My whole chest will lock up.
Right.
And then I'll have to try and crack it.
Yeah. So you just described what's happening. So what's happening is that often there's this mechanical problem involving your ribs and your breathing mechanism. Your ribs, which are attached in the front here in your sternum and to the back to your spine, there are literally joints there. And your ribs need to move when you breathe. And they move in a way where what's called a bucket handle. They roll up and they come out. And so your chest can come out and your ribs need to be able to move like that freely. Mm-hmm. What can happen sometimes for many reasons, you could fall, you could hit something, or you could bump into something, and you can injure or damage one of those ribs a little bit or get them inflamed, and they become locked and they won't move anymore, right? So now you go to breathe and it won't move.
Yeah. And
then that can cause pain. And then if you have a joint that's inflamed, the muscles around it go into a state of spasm. So they contract. So now your chest muscle locks down, and now that makes it even worse.
Okay.
And so now all of this is mostly happening, even though you might feel a little discomfort, most of this is usually subconscious. Like you're not feeling like, oh, my rib is hurting. It's like you're feeling, my chest feels tight and I might feel a little bit of pain, but maybe not. But what happens is because you can't expand your ribs fully, the breathing is literally controlled by your brain and your brainstem. And there are two different areas in your brainstem that regulate inspiration and expiration. So there should be a perfect ratio of how much you breathe in versus how much you breathe out. Okay. And that's literally regulated by two different centers in your brainstem. And if all of a sudden you can't breathe out or breathe in, your brain starts to try to compensate because you're breathing in oxygen and you're breathing out carbon dioxide. And that maintains what we call a pH balance. So your acidity versus your base in your bloodstream, that acidity level is in large part regulated by the balance of oxygen and carbon dioxide. And you're breathing in oxygen and breathing out carbon dioxide. If that ratio becomes disrupted, it literally disrupts the balance of that pH in your blood. And then that affects your calcium around your nerves. And that's what causes the tingling. So when you're hyperventilating and you're not breathing properly, the first thing that will happen is you will get numbness usually around your face or your lips or in your fingertips.
Yeah.
And that's how you know that it isn't really an anxiety attack. So an anxiety attack, if you were to go to the hospital, they would say, this is an anxiety attack. It's all in your head. You're just mental, right? And you would feel like, okay, there's something wrong with me.
Yeah.
And now imagine if that kept on happening.
Yeah.
And you weren't feeling anxious or nervous. And you might even be really happy. And then all of a sudden you start having all of these symptoms where now you feel like you're going to die. And you feel anxious and you go to the hospital and they keep on telling you basically that you're crazy and it's all in your head. You start thinking, oh my God, I must be having incredible anxiety that I'm not even aware of.
Right.
And then people spin out of control. And I've seen many people become agoraphobic from that.
What?
Oh yeah. I can tell you a story in a second, but yeah, so it's really pretty fascinating, right? Because actually it's an easy fix. If somebody was to get the ribs to start moving, like do a quick adjustment or do some ultrasound around the muscles or stretch and relax the muscles and get you to start breathing, the whole thing would go away.
So where do all the negative, oh yeah, I think you've told me this before because I was like, that happens to me pretty often, luckily not as often lately, But then I would have all these horrible thoughts. But you're saying that like those come afterwards because you're
Yes.
like, oh, I must feel terrible. Now I'm going to think about all these terrible things.
Right. And imagine, like you said, it's chest pain. So imagine if you're getting chest pain on the left side. And most people know when you get a heart attack, you're feeling it on the left side, right? You may not know that. Left and right. I'm just looking at you.
Which side?
Left and right. It's going to be hard here. But this side of your heart. And so if you start getting this crushing pain on your left side, and that pain may start to go down your arm and even come up, most people are going to say that's the signs of a heart attack. And in fact, it is. But it's also because your heart is a muscle, and if it doesn't have as much oxygen, or if it contracts or goes into spasm, that's a heart attack. And like any other muscle, it has pain, and it will refer that pain in a specific pattern. But your chest muscle will also refer it in a very similar pattern. So you can imagine that if you were somebody who started feeling some breathing issues, and you started feeling tingling and numbness, and you feel like, what the hell is going on here? Like, am I having a stroke? And then you start feeling pain, and then you start panicking.
Yeah.
And then as soon as you release adrenaline in your system, it goes into high gear. I had a woman that was on such a bad panic attack.
Now I'm like
time.
convincing myself I'm having a panic attack. I need to chill.
I had a woman one time that this happened so quickly and so fast. She walked into my office having one and kind of knew what it was. And within like 5, maybe 6 minutes, she was on a table laying there, and she could not speak. She couldn't do anything because everything had shut down so much. And this woman was a physician's assistant, so she knew a lot. So it can get really severe. I mean, literally, like you could be almost paralyzed and not be able to do it. And again, you're going to be told this is purely anxiety. And because most people in an ER don't understand the mechanics of the ribs and the structure of the body, they may actually tell you, well, it's irritation of your chest cartilage, which is kind of true. It's called TT syndrome. And that may be, and
It's a cute name.
Huh?
So that's a cute name.
Yeah, it's not as cute as schizophobia, but it's a good name, though. I still love schizophobia. That's my best. That's my favorite. So, but, so this is, there is a relatively easy solution for this, but it can really get completely out of control.
Okay, so then tell me the crazy agoraphobia story.
Yeah, so there was a young guy, probably late 30s, early 40s, and, his mom, I've been seeing his mom as a patient, and she said, we were talking about something, and I was talking about, breathing issues and rib issues and how that can cause what people think are anxiety or panic attacks, but they're really hyperventilation attacks. And she said, oh my God, my son has been suffering with this for like 5 years. Like he won't even come out of his house or anything. He lost his whole career. And I was like, wow. And she said, can you help him? I said, I think so. Have him come in. So he did. He called me on the phone first and we talked, and then he felt comfortable enough and he came in and he told me the story. So he was good. I mean, he was a salesman, really successful. I think he worked for like a liquor company or something, and he would travel around. That was his job. He would drive, and he was really happy. He was in a good relationship. He had a really nice home. He was making a lot of money. And one day he was driving around, and he was driving like some big open space, and he started feeling like his lips started going numb, and he started feeling tingling in his hands, and he started to realize that he felt like he was having trouble breathing, and he was getting really nervous, and the more he was driving, the more he was getting nervous. And so I think he ended up driving himself to a hospital. And at the hospital, they said, well, you just had a panic attack. You were having an anxiety attack. And he said, I didn't have any anxiety. They said, well, you must have, because, this was pretty severe, and, you might have some subconscious anxiety that you're really worried over, and you need to relax. You need to like do some stress reduction or whatever. And he was just like, but I'm really happy in my life right now. And they were like, well, you're not on a subconscious level. So now that put that into his head.
Yeah.
And now, but in his mind now, he was like, all right, this was triggered by me driving in an open space. So now he drove to avoid open spaces, right? He didn't want to drive. But then driving in a mountain road one time, it started to come on again. And now he was like, okay, he went to the hospital again. They told him it was an anxiety attack. And so now it was like, okay, now it was triggered by mountain roads and open spaces. Then he went to a supermarket and it happened. And he was like, now it's triggered by supermarkets. So he started immediately connecting it with, because he couldn't think of anything else that was doing it, right?
Right.
And so he came to me and we started talking. And so I said to him, before this all started, did you have any injuries, any physical injuries or anything? I said, think back. And he was like, actually, the weekend before it happened, I was playing like football with my buddies. And I got hit in the chest and it hurt a little bit. But I didn't think anything because I'm just playing football with my buddies, you know, and he didn't think about it. But that's exactly what happened. He had taken a blow to the chest. It had locked up one of his ribs. And now what happens is that he wasn't breathing fully.
Wow.
So now the brain, what it will do is it will make you speed up your breathing to compensate for not breathing as deeply.
Yeah.
So if you can't breathe as deeply, your brain will speed up your breathing centers.
Okay.
And now instead of making more oxygen come in, you end up blowing off too much carbon dioxide. And so now what happens is as you do that, you change the pH of your blood. You make it more alkalotic rather than acidosis. And what happens...
Sorry, those are crazy words, but okay.
Schizophobia. And then that causes, again, a release of calcium in your nerve endings, which causes the tingling, which then produces the symptoms and the muscle contraction. And then the more you feel anxious, you release adrenaline, and then adrenaline takes it to a whole different level where, like I said, I've seen people completely catatonic, like can't move their body because their whole body is literally numb. And so this guy, this is what happened to him. After a while, he couldn't go anywhere without it being triggered. So he stopped going anywhere. He lost his job. He lost his relationship. He only lived at home. And he couldn't go anywhere, and he just felt like he must be absolutely crazy or insane. And then he started to act crazy and insane. And then he came into me, and I related this to him. And this is a God's honest true story. I adjusted him once, got his rib opening. As soon as I did that, there was like this physical reaction in him. And all of a sudden, this pain that he had been there, that he didn't really almost realize it was there, was gone. And I treated him one more time, and then it was gone. And he never had the problem again. And the only thing he was left with is he was so angry that he just lost 5 years of his life and lost his career and his girlfriend because no one knew what it was.
Oh, man. Wow, that's crazy.
So just quick thing. If you feel like you have a panic attack or you have it or you've been told you have it, if you feel any numbness, like in your lips or in your fingers or in your tongue, the primary problem is most likely a breathing mechanical problem in your ribs and your chest. And if you think about if you did anything where you could have hurt it, you could have injured it, you could have been shoveling snow, you could have gone to the gym and just, weight hit your chest, and you don't think about that as an issue. And it may not be like a big pain, but it affects the way you breathe. And that may cause this to happen. Now, not that people don't have true anxiety attacks, and they do, but that usually starts with anxiety. It usually starts with people being anxious about something first, and then they go and they usually don't get the tingling in their mouth or their fingers. They don't get that numbness.
That's weird. Now I'm like thinking about, I definitely get anxiety attacks and panic attacks. But I guess I can't differentiate them in my head.
The differentiation is the numbness.
Yeah, that's crazy.
Right? Because think about it. Have you had panic attacks or anxiety attacks where you haven't gotten that numbness? First.
I don't know. Now I'm going to have to think about it.
You may not have. And that means crazy. That it's not, it's not being... The anxiety comes out with your brain trying to figure what... First of all, the anxiety is, I feel like I'm going to die.
Yeah.
Because if you can't breathe, you feel like you're going to die. And then your heart starts racing, and then you feel like there's something wrong with your heart. And then if you feel like you're getting numbness and tingling, and you might even lose part of the ability to speak because if your tongue goes numb, and then you feel like, okay, I must be having a stroke, or something, right? And so that nerves then trigger that sympathetic, release of adrenaline, and then it makes it even worse.
Yeah.
But then there are some people that really will just be anxious about something, or they're worried about something, and then that kind of, will trigger that feeling. And they may feel like a claustrophobic or something, but they're usually not going to have the physical symptoms first. It usually comes secondary if they have them at all. And the anxiety or whatever's triggering the anxiety. And if you ask them, did you have an anxiety attack? They'll tell you yes, and I know exactly why, right? Whereas somebody who may have an anxiety panic attack that is really a hyperventilation attack, they may say, I wasn't anxious at all. Like, that's what makes them crazy, is because they're like, this guy was like, I was the happiest I've ever been in my life. And they're telling me that I have this anxiety and that I must be crazy.
Damn, dude. I feel bad for that guy.
Yep. Well, he was very happy afterwards.
Hopefully he went back to his girlfriend and he was like, listen, it's that football game. My chest was locked up. Baby, come back. And hopefully she did.
I hope so too. I'd like to believe that.
Yeah, I'd like to believe
and we'll believe that he lives in that world somewhere.
Okay, good.
But this is an important thing, because a lot of people, I remember I had a friend of mine that worked in an ER, and he said to me, one of the biggest things we see is people come in with panic attacks. And I said
in
to
the
him,
ER?
Yeah. He's like, we see it a lot. And I said, do you ever ask them about, like, do you ever look like they might have some mechanical problem breathing in their ribs and his chest? And he's like, not really. He said, maybe if they really complain about pain in their chest, we may, and if it's really tender, then we might kind of relate the two together. But he's like, no, that's the last thing we usually think of. We usually think first, is it a heart attack, right? Is it really, or are they having a heart attack? Is there something going on with their blood pressure or with, the way their cardiovascular system is working? And then they go right to, well, it's a mental issue. That's a psychiatric issue. And they may call in a psychiatrist or something like that.
Interesting. Okay, so what about, because my dad's good friend, Peter. What's up, Peter? I talked to him because I just wanted to get my gut right, and he was giving me supplements and stuff, and he was like, what's your morning look like? I'm like, I wake up and I chug 3 iced coffees. And he's like, okay. He's like, I think he actually even guessed it. He was like, let me guess. You don't eat anything. You drink your iced coffee, you do this, you work out. And I was like, yeah. And he was like, how does that make you feel? I was like, gives me an anxiety attack every morning, but I still do it. So I feel like a lot of people, if they drink too much coffee or something like that, will have an anxiety attack. Do you know why that would be? Or does that have anything to do with that?
Yes, because what we talked about is ultimately what makes you feel again, your heart starts racing, or you feel some breathing issue. Anything that changes the metabolism of your blood level, right? So if it alters your blood sugar, or if it alters your pH balance in some way. And so if you're drinking coffee, like I said to you, if adrenaline kicks in, right, that brings it all to another level. Well, adrenal receptors are basically in the sympathetic nervous system. They're in the fight or flight. And if you drink a lot of coffee, we've all experienced that, where we've gotten to a point where we're like, you feel a little lightheaded or spacey, and you feel like your heart's racing in your chest because you had that too much coffee. And so you're mimicking that effect to a certain extent by doing that. And then also what may happen is when you do that, you also will mess with your blood sugar levels. And you may either release too much sugar, and then, so when you're in a stressed state, like an acutely stressed state, that's more of an inflammatory response. So like when you're fight or flight, or let's say you've drank too much coffee, and now you've literally kicked in that sympathetic nervous system. And what it does is it then causes a release of cortisol, and then cortisol causes you to release blood sugar into your bloodstream, because your brain and your body is saying, I don't have enough energy, so I need sugar, I need glucose. So it goes into your muscles and it takes blood and it puts it into your blood sugar. And now it has to go from your blood sugar into your cells for actual energy. So then you release insulin. And insulin is what takes the sugar into your cell that you use it to produce energy, ATP. You remember from biology, right?
Sure.
And so now if you get too much sugar or you have too much insulin, what happens is it will then take all the blood out of your sugar, all the sugar out of your blood, and then it can go into what we call triglycerides. And then you might get low blood sugar. Or if you don't eat and you starve yourself, and now you have low blood sugar, and now you also have kicked in your adrenaline system. Now you just feel like shaky and you feel like you're spacey, or you feel like you're going to pass out because, again, your brain needs oxygen and glucose. If you don't have either one of those, because you're not breathing or you don't have any blood sugar there and you're using it up and now you've depleted it, your brain feels like it's going to pass out. And those two things are interrelated to one another.
Wow. I'm like taking on all these symptoms right now. I need to stop.
Well, that's why, that's why starving yourself, not eating is not a great strategy for losing weight, because ultimately it makes that shut down. It actually increases your stress response in your body. It actually makes you crave carbohydrates and makes you deposit fat faster. And so that's why we know, just starving yourself.
Except, what's it called? Fasting is good for you.
Intermittent fasting.
Intermittent fasting.
Intermittent fasting is good for you.
Dr. Rob loves an intermittent fast.
I love it.
Then just a whole bag of cashews the next day.
And we can talk in another one about intermittent fasting and the keto diet, because that's another thing that the ketogenic diet started in the childhood neurological community. It actually started as a way of stopping kids who had seizures. And that's what really started the whole ketogenic diet. And again, people don't know that.
I didn't know that.
Yep. It started in 1940s in Johns Hopkins Hospital for kids that had really bad seizures. So we'll talk about that, because that's also another important thing. But again, a lot of these things like, gluten and dairy free started in the autism community. Ketogenic diet actually started with kids with seizures. So again, I know this stuff really well because a lot of this actually started in this community, and, I was involved with this early on.
Okay. So basically what you're saying is if you get your brain more balanced, your gut will be more balanced. And if your face is going numb, go get an adjustment stat.
Yeah, that's the thing that people won't think about, that one of the people that might help you the most if you're having these kind of panic attacks where they're really hyperventilation, and it may be because of a rib and you're feeling some pain in your chest or your back or your lower neck, is if you go to a chiropractor that really knows this stuff and can adjust you, they may be the only people that can help you. And so, whereas if you think it's a mental health thing, you're not going to think, oh, I'm going to go see a chiropractor. But if you realize that it may be actually a physical mechanical problem, it may be. And again, most food sensitivities, digestive issues, there can be many factors around it, but in many of them, the foundation of it really is in the brain and the brainstem and brain development. And so if it's associated in any way with any sort of mental health, anxiety, depression, anything like that, then they may be more related. And it doesn't start in the gut. It actually starts in your brain and your brainstem. And doing those diets and eliminating foods and identifying them. And that's another thing. We have people that come in, I have parents that come in and they'll do, I always ask them, have you ever done any special diets? And they'll say, we did a gluten and dairy free. And I'll say, okay. And then they say, I'll say to them, did you do it 100%? And they're like, no, not 100%. We did it like 90%. And it doesn't work that way. So they didn't know how to do it. They did it wrong. So they're assuming that it didn't make any difference, but they didn't do it right. And then they only did gluten and dairy. So what we do is we do blood tests and we look at the child for antibodies against like 200 different foods. And what we'll find is that a number of these kids may have no sensitivities in their immune system to gluten and dairy foods, but they do have it to other foods, and it can be really high. So you're eliminating gluten and dairy. Okay, that's great, but they didn't have a sensitivity to gluten and dairy, but they did have sensitivities to other foods, but you didn't look at those foods. So that's another thing. If you're going to do an elimination diet, you should go to someone that really knows what they're talking about, and that you should get a blood test to look at your own food sensitivities. And then if you do it, it has to be 100% for at least 5 or 6 weeks.
Why? Like if someone does it only 90%, they just want to have a little cheat day?
Can't work that way.
No
because
cheat days.
What happens is
no days off, guys.
The only way you know if it's going to help you is if you completely flush it out of your system. Because what's happening is there's an alteration in your immune system, and what happens is when you eat it on a microscopic level, the amino acids will trigger antibodies in your bloodstream, and your immune system literally feels like it's under attack from like a virus or a bacteria or something. So it releases chemicals that literally are like if you're sick. Okay? Mm-hmm. And talking about microscopic levels can trigger that. So, and it takes, people argue over this. I think it takes at least around 4 to 6 weeks for those antibodies and for those chemicals to be cleared out of your system completely. So after 4 to 6 weeks, you may feel very different. Like, oh, wow, I feel really different now. Whereas before that, you didn't. And now if you eat the food, you may feel like crap. And then you're like, oh, well, and that's really the most accurate way to tell if you have a food sensitivity. But if you ate that food before you hit that 4 or 5 weeks, you wouldn't feel different because you didn't feel better yet, because it was still in your system. And so you didn't get to see what your body was really like with it completely out of your system.
Okay.
And it has to be completely out, because if it's an immune response, even small amounts, microscopic bits of it will trigger this immune response.
Damn. That's a bummer.
It's like if you have an allergy. If you have an allergy, little bits of it may trigger a severe allergic response. And, you don't usually get over that allergy, but food sensitivities are something different.
Okay.
Yeah. And that's another thing. It's a big difference between a food allergy and a hypersensitivity. They're completely different mechanisms in the immune system. They involve different antibodies, different chemicals. And so a lot of people refer to like if you have a gluten allergy, that's what we call celiac disease, and that's usually associated with severe gut issues.
And then there's gluten intolerance,
and then there's gluten intolerance,
okay,
which is very different, and it might not cause gut symptoms, and it doesn't cause allergic responses. So it doesn't cause a release of histamine. It doesn't make you have like watery eyes or runny nose or hives. It just creates inflammation in your body. And so you may just feel bloated, or with kids, we may just see they get irritable, or they get hyperactive, or they can't concentrate, or they get, aggressive, or they can't sleep. But it doesn't show up like an allergy. So there's a very big difference between an allergy and a food sensitivity.
Wow. Okay. Yeah, because you also said whenever like my stomach hurts, I always get depressed, or have like a bad day. But then I don't think about that it's probably because my stomach is really hurting me. But you said that your body does that to you because basically from my understanding and speaking in layman's terms, inflammation in your body is can cause depression and anxiety in a sense, or depression mostly, I guess, because when you're sick, your body wants you to slow down and kind of feel the sickness so that you get better. But if you're constantly in a state of inflammation and constantly feeling sick, then you're constantly your body's sending signals to kind of be depressed because it wants you to get better, but you're never getting better.
Right. Exactly. And that's the difference between an acute stress response, if you really feel like you're nervous or scared, let's say you're walking down the stairs and you almost fall or something, and your heart rate goes up, and then after a few minutes, it calms back down versus chronically, if you're in that state all the time,
Chronically,
all day.
that was the word I was looking for. Just know I had it in the back of my head.
I knew, I read it. That's
Okay,
why I
thank
said
you.
it. And it really, and there's a big difference in your body in a acute, physiological stress response versus a chronic stress response. And chronic stress responses, are devastating to your body and your brain over time. It's really, and that's where we live. Most people in the world now, again, are really struggling with what we call chronic illnesses. That's why traditional medicine was never designed for chronic illnesses. And that's why functional medicine or, more holistic medicine really developed, because traditional medicine didn't have the answers for that. And, when you look at people suffering from cardiovascular diseases or cancer or diabetes or obesity, these are chronic illnesses. And most of the mental health issues are really the same thing driving those chronic illnesses is the same thing driving the rise of ADHD and OCD and autism and childhood and adult mental health issues.
Wow. Okay, that's fascinating. So basically, because obviously we like to tell people how they can help themselves. And we are going to start doing episodes where we'll like show you things that he does to help people. But kind of all of these like episodes that we've been doing have been just like established so that you guys understand what we're even talking about. But I know from talking to Peter Schreier that like there's certain supplements and things that you can do to like balance out your gut. But what would be your suggestion to people that are suffering with this? Like they should go get that blood test that you're talking about where they figure out if they have intolerances, if they have allergies, what they are, and then probably an elimination type thing.
Yeah, because it's almost impossible for you to know what foods are triggering this, because first of all, it's not an allergic response. If you have a food allergy, like a peanut allergy, people know it. Mm-hmm. If you have an allergy to gluten, which is celiac disease, you know it. As soon as you eat it, it's called an immediate hypersensitivity response. But if you have a delayed hypersensitivity, which is a food intolerance, it can take, 2 to 3 days for it to show up.
Oh, weird.
Which means you could have eaten something, like you had a slice of pizza 2 days ago, you felt fine, and then 3 days later you feel like crap.
And then you would never think, oh, that's from the pizza I ate 3 days ago.
You would never know that.
I've never thought about that.
And so that's why to try to figure it out, I mean, some people sit down and they'll do a food diary and everything, a diary, but even that.
Nerds. No, I'm just kidding.
but even that, what were we going to talk about? Your diary.
My diary, yeah.
Even that, because again, it's so hard to correlate it. So that's where what people should do is get a blood test with someone that knows. And it's not an allergy test. So a lot of people say, I went to an allergist and they did a blood test and I don't have a gluten allergy. Like, okay, yeah, you don't have a gluten allergy. You don't have celiac disease. But did they look at IgG and IgM and did they look at other antibodies? And it turns out, no, they only looked at IgE, which is for allergies. So you didn't have an allergy. It doesn't mean you don't have a food sensitivity. So you need to get a food sensitivity test. And you need to do it with a good lab. And then from there, you can use that to choose, you're going to eliminate certain foods, and they have to be eliminated for, in my book, at least 5 or 6 weeks, completely, 100%. So if you're exposed to it at all, you have to start over again. And then you see how you feel. And then you reintroduce that food again and see if it makes you feel crappy in one way or the other. And that's really the best way to know. And, you can go through a whole bunch of different foods. In my book, I talk about that. There's really like 10 foods that are the most common foods. Like if you don't want to get a blood test and you don't want to go through that. Even now, the blood tests are like finger prick tests. They're pretty easy to do. You don't have to do a full blood draw. And that's what we do on most kids. We just do the finger prick test and they're accurate. But eliminating and then reintroducing is the only way you know if for sure, and the blood test isn't 100% accurate either. So that's really what you want to do. And you want to work with someone that knows how to do this properly. But again, this may all be started really by your brain. And so you need to be able to understand and work with someone that also knows, looking like, do you have primitive reflexes? Did you have any issues with early development? are there any, imbalances? Are you really good at certain things, or you have extreme areas, and do you have other areas? So all the imbalance stuff that we've talked about.
Right. Okay. All right. I think that was like really great.
Yeah, I think we gave them a lot of practical information.
Yeah. I'm still like that whole story about that guy. That's sticking with me.
Yep.
Okay, guys. Well, I hope this was helpful. Go get an adjustment if you're having panic attacks. And yeah, get your food allergies checked out. Thanks, Dad. Very informative once again.
Thank you. And next time, can we talk about schizophobia?
We can talk about schizophobia. Let me just work out what it is a little bit more. Okay, great. Love you.
Love you, honey.